Hi, Dr. Becky here. This is the second part of a discussion about the relaxation response. This is a concept that can help us work with our physical stress in particular, and if we can help quiet the body, we can also help quiet the mind and vice versa. So, a couple of things that I wanted to elaborate on. The first one is the aspect of this that most of us have the most trouble with is this fourth one of an allowing attitude. As we have spoken previously, having a sense of control is a powerful tool in the stress management toolbox. Over and over again, studies talk about the more control we feel that we have, we tend to have less stress in general. So we want more control, but it's paradoxical when we think about certain aspects of our experience, and that is that the more we try, the further away it gets. I used to do biofeedback, and I used to do it with people who had insomnia. And we would set it up so that people were in a lazy boy. I had the lights down, so people were in a comfortable position. It was a quiet environment. And then I would lead people through a relaxation exercise. So there was a focus of attention that was neutral or pleasant and repetitive. So they would be hooked up to the sensors as we did this. When we got to the end of the experience, I would ask people how that felt for them, and almost universally indicated that they felt more relaxed and that it had been pleasant. The interesting thing was that their muscle tension and tightness actually went up slightly. And I think that was for a couple of reasons. I think that one is that this was something new and they were trying a little bit too hard, understandably, but that caused their muscle tension and tightness to go up just a little bit. I think that the other thing is that for some of us, we live with a baseline stress level that's not at zero and that's high enough that we've forgotten what it feels like to be physiologically relaxed. So even though they felt more mentally relaxed, this was a situation where the mental relaxation didn't necessarily carry over for them into the physical relaxation. So, especially those of us who tend to be worriers, we worry. The lie of worry is that if we just think about and worry, that we'll have more control. Worry is about control, trying to control something we don't have control over. If you're wired that way, the tendency is to want to make relaxation happen. When you're more stressed, obviously you want to relax, but just how you notice how there's a tightening and tensing just in thinking about that. So what we know about relaxation is that it's not something that we can learn the techniques and then just use them when we feel we need them. It's something we have to practice. Now, Dr. Benson talked about 10 to 20 minutes of practicing these principles, and again, we'll talk about some techniques for that in other videos, but 10 to 20 minutes once or twice a day. There are studies that talk about doing more. There are studies that talk about even some brief periods can be helpful. So the idea is that you practice so that when you need to use the principles in the real world, you can do that. So you set aside some time in your day where you make things quiet, you get in a comfortable position, you find that focus of attention, and you practice for 10 to 20 minutes a couple of times a day. That's the suggestion. Obviously, not everybody can do that. So that's the baseline practice. And then once you know that, you don't have to have all of it. Remember that the quiet environment and the comfortable position are relative. They're nice things, but they're not necessary. So I remember a time when I worked in the hospital and I was asked to do a number of consults, more than I was going to be able to do within the time that I had. And my stress level was already quite high. So I'm walking from one side of the hospital to the other, going to acute care, getting ready to do these, and my mind is just going, just spinning, and my body is so tight and tense, I'm almost stomping. And I remember stopping in the stairwell and just stopping. And in that moment, just simply letting go of all those other things. And for about 2 minutes, I just focused on my breathing. So I simply chose to block out, in a sense, those other things, or actually more accurately, to let them go. Focus on something neutral or pleasant and repetitive, and just had this allowing attitude. I still wasn't able to get all of the things done, but I can assure you that my ability to be present with the patient that I saw was enormously better than it would have been if my mind was all caught up in everything else. And I was much more effective, able to be quicker, if you will, in a more effective manner, and it was better for both the patient and myself. So it doesn't have to be a long 10 to 20 minute practice all the time in terms of the real world. It can be just a few moments, but you can do that because you've been practicing. So we'll continue to build on this in future videos.